Philips' strategy for AI is really to enable what we call the quadruple aim. So it's all about creating better outcomes for patients, so better clinical outcomes, and that means really deep understanding of the drivers of health and the drivers of disease. And that means sifting through very complex information that can be measured, or it can be in an image, it can be in pathology, it can be in genomics, it can be in a waveform, it can be in clinical notes. So you understand where we're going there. To bring that information together, you need AI to sift through it, to put structure to it, and to give it meaning. The second part, where we say, so we want to optimize clinical outcomes, we also want to create better productivity for care, so less variance, optimization of very expensive assets and resources. And in a way, healthcare is an optimization problem. You have patients with different acuities, and you have limited resources. You have limited ICU beds, you have limited capacity in your emergency room, in your operating theaters, in your cath labs. In your resources, there's a given number of nurses. So how can we optimize the patient flow and the clinical flow in order to make demand and supply meet in a dynamic way? And I think that dynamic nature has not been there in healthcare yet. And then the third area, so it's clinical outcomes, it's operational outcomes, but the third area is how can we create a much better experience for the patient? So we understand the patient better, but we also understand that many patients that have a disease have that disease for the rest of their life, be it congestive heart failure or diabetes or a mental issue. We see the need for 24/7 support of chronic disease. So we need the AI to glean information, maybe from their wearables, from continuous glucose meter, from an insulin pen, from a blood pressure meter in context of their situation, and then do it in a way that it's very natural for that patient to deal with that and to get their insights in a natural way. And lastly, so that's the patient experience, and lastly, the professional experience. Healthcare professionals have sometimes to make life and death decisions in a split second or in a limited time. So how can we then make sure that they get the information they need that's fit to their understanding? So how can we tune the information to their decision making and reduce the need to spend a lot of time at administrative things, so enter data into systems, for instance. So how can we use voice-based systems, natural language processing, to create the natural interface? How can we understand how patients live every day and make information, clinical information, behavioral information part of what they're doing every day? So that's our 10,000 feet strategy. Now, if you bring it down to the ground level, you'll see that virtually every product on offer here has AI already built into it. You go to our sleep apnea device, AI will understand your patterns of breathing, and automatically the ventilator will adjust to your breathing. AI in the background will look at your sleep patterns and deploy a coaching algorithm that gives you guidance on how to better sleep and how to better control your pulmonary condition. If you look at our radiology, our MR machine, so we have a product in the market today that reduces scan time by 30 to 50%. How do we do that? With AI. We have AI start gradually filling in the image that we create, and therefore we can have the same quality image in half of the time. That's big, because that means you can do many more scans in a day and optimize your assets. But for a patient, it's good news as well, because they reduce scan time. We believe there's a big opportunity to really link and interpret all that diagnostic information longitudinally to you. So to capture information that greatly fills in that model of you. And that model, of course, becomes very important because it allows you to predict, to simulate, to compare. And that was never possible. We maybe could compare an image. We could definitely compare, blood pressure readings, but we could never compare a bigger picture of you that includes imaging, genomics, monitoring information, medication information, interpretation of events that happened to you in the past, dose of medication, interplay between medications. And I think now we have that opportunity, and that's a combination of AI and real physiological models. So it's a model of your heart, and the model of the heart that we start filling in, just like we're doing with the MR image. We gradually fill in, and gradually we understand more and more and more about your heart. And it's more precise and more predictive, but it can be applied to your lungs, to your brain, ultimately to your metabolics, to your genome sequence, to the proteins in your blood. So the more we glean, the more we can start understanding what truly drives your health, what truly drives disease, and not just with you, but people like you, and therapies that worked for certain profiles, whether the probability that it will work for you as well. So it's not just giving you a much more precise view and predictive view on your own health. The amazing opportunity is to compare it with millions of others. And that was never possible. That was never possible in the history of medicine. And that is the big thing about AI. So it helps us become more precise, but it also helps us to codify and share and to learn with every interaction. Every reading, every report that a radiology writes these days in our system means the system learns. The system learns about what information a radiologist is looking for. The system learns about what to compare. The system learns about how to compare previous studies. And with every reading, every study, it learns more. And it will do that for thousands of radiologists simultaneously, which creates a tremendous potential base of knowledge that we can tap into to progress medicine. Yeah, so it's interesting. If you say radiology and AI is going to be assisting us in disease detection and interpretation, of course, that can never happen without, radiologists. And that can never happen without people who are real subspecialists in the field. And I asked a leading radiologist, let's say 5 to 10 years, how many algorithms will be loaded into the system that you're looking at? And he basically said tens of thousands, because there's so many specific areas and contextual views that we have to look at. And it's obviously not Philips or GE or Siemens, so it's the industry that's going to enable that. And that's why we invested a lot in creating an AI workbench with annotated data that we already have over 50 university medical centers and over 50 startups participating in, so that we can help them do their research, validate their algorithms, have different annotated data sets to learn on, but also to validate, and then have the systems that allow you to deploy it in clinical practice, because that's the last mile that will be the hardest. There will be thousands of smart people building algorithms, but how do we get them as part of the clinical practice? And I think we're addressing that challenge with our overall platform strategy. So we believe there's tremendous opportunity in open innovation, and we're a big proponent of open innovation. That means opening up your systems, opening up your platforms, but also proactively engaging with startups. So HealthWorks is the organization that lead that open venturing, open support of startups. And a couple of months back, we did a global challenge for AI for radiology, cardiology, and oncology. We had 750 startups actually participate, and we down selected 19 of them that we felt had tremendous promise. And we actually guided the teams. So typically these teams are very interested. They tend to be a combination of clinicians, clearly understanding the domain, data scientists, experienced designers, so how can you visualize information, how can you express relevant information, business folks, what's the business model, and bringing these teams together, that creates the flywheel. But then giving them access to, all the capabilities we have with Philips offers up a tremendous opportunity for these startups. So we down selected 19 of them, and each of them walked away with a contract with one of our businesses. And many of them were discussing taking a seed stake as well, giving them some money to continue their great ideas and participate, as a venture company as well. So we have a corporate venture team that works with HealthWorks that really assesses and say, hey, these guys are really cool, let's give them some money, let's give them some access to IP expertise, to entrepreneurial expertise. And if we bring them into our orbit, everybody wins. Our patients win, our providers win, and we win, and the startup win.
That's fantastic. And is that a yearly competition?
No, we regularly do these challenges. Our next challenge is going to be around acute care.
Oh, so you're going to change the subject matter.
So this was more on image interpretation,
right.
and that will be more on vital signs interpretation. Okay. Contextual vital signs interpretation. So we're looking at challenges that really fit with the needs of the healthcare systems. Well, I think we're on a good trajectory. We've been very clear, we're an open innovation health tech company. Our goal is to provide great health to billions of people. And we do that from a consumer perspective, give people the tools and the information to live healthy lives. Our goal is to enable precision medicine, what I talked about earlier, the digital twins, truly deep insight in what drives health. Our commitment is to connected care, building on the huge franchise we have in monitoring. 43% of all monitors in the world are Philips, but they're largely in ICU. So how can we monitor anywhere with evidence-based, clinical proven solutions and help people live healthy lives in the connected care? And lastly, a big commitment to minimally invasive procedures. We believe there's a lot you can do now with smart catheters and image-guided and robotics and augmented reality-guided procedures. And we're highly committed to step up that game as well. And in terms of AI, that's probably one of the real interesting areas, because you have multimodality, you have X-ray, you have ultrasound, you have smart catheters. And we're even now looking at using virtual reality and augmented reality for surgery. So you're wearing the HoloLens, and actually you look at the patient and all the information is overlaid on the patient, and you literally see the catheter going through the body, while you can give voice commands to the C-arm and move it. And you can personalize as a surgeon how you want to lay that information out. And I personally did surgery on a dummy, don't worry, using robotics. But basically the system only asks you to directionally do the right thing, and the precision is provided by the robot. And that is a whole new world that will continue to move the boundary on what we can do in terms of minimally invasive procedures.